In this video, you're going to learn the 5 most essential yoga exercises to resolve low back pain that's related to an unstable core. I say that these are the most essential because these are the foundation for almost all yoga routines, and these are the common denominator in almost every physical therapy or rehabilitation program. So they're the basics. Even though they're the basics, people still do them incorrectly. So really the reason I want to make this is to show you the most common mistakes that I see when I'm demonstrating or showing people these exercises, the things that they do incorrectly, how to resolve that so that these can be as effective as possible for anybody suffering from low back pain and really wants to strengthen their core. Before we get started with yoga, one of the most important things is they incorporate deep, relaxed breathing. This is for 2 reasons. One, when we breathe deeply and we're relaxed, we use the diaphragm. A lot of people stress tension cycles where they breathe up in here. That's no good for yoga and for these exercises. You want to breathe low, it in the diaphragm. The other reason that you want to do these nice relaxed breathing is that it helps kind of wake up your nervous system into the core, wakes up those muscles, wakes up your mind-body connection, if you will, gives you more body awareness. So let's get started. Because an abdominal brace is one of the most important aspects of all of these exercises, I'm going to start with the plank. Front plank is pretty basic. Most people are familiar with this, so I'm just going to quickly go over some of the mistakes that I see for anybody who is new to this exercise, if they haven't seen this before. One thing is, some people are really low here, especially if they have an unstable core. This not only can put a lot of unnecessary pressure on the low back, but it's not very effective either. So you want to be hips up, about right there. It might be kind of level, maybe a little higher. The other thing is, some people will be too high. This isn't necessarily bad for your back or going to hurt your back. However, it's not going to be as effective. So again, here. And we talked about the breathing. You want to breathe. How long should you hold this? As long as you comfortably can. You've got a couple options. Some people like to do plank challenges and really hold the endurance, see how long they can hold this. And for some people, if they're just getting started, it might be 10 to 15 seconds, and you're going to do 3 to 5 sets. All right, so now I'm going to show you how to transition into what's called a side plank. You want to elbow under the shoulders, move the forearm this way here, move the whole body as a unit, and just come over. Hips want to be nice and high up from the floor here, and you hold, again, breathe. This one is really important. It might be one of the most important because the side abdominal muscles, people with chronic low back pain, a lot of times these are the weak muscles, so this one's really important. So I'm going to turn a few times, transition from side to side, and really watch my feet. I don't have to pick my feet up. As I do these, my feet just kind of rotate. Some people like to stack here. That's fine. If you want to do that, you can. I think it's completely okay to be right here. And again, as you rotate, move the whole body together. Just let the feet move. Do it one more time. And that's it. How long do you hold this? Again, as long as you comfortably can. You're really trying to challenge the endurance of these muscles. If that is too difficult, you can do it from the knees. You have a bend in your hips. You have a bend in your knees, and your heels are lined up with your butt. You're going to bring the hips up, and you're going to come forward. Side plank from the knees, same thing, same rules apply. Hold it as long as you comfortably can, or do sets of maybe 10 to 15 seconds and 3 to 5 sets. All right, the next exercise, number 2, this is called a bird dog. This one is really good for the low back, backs of the shoulders, and the glute muscles here. Breathe. Hold. You can do both sides. Here's a couple common mistakes that I see with this one. One, people kind of want to arch, and they're like this here. The fix for that one is stable in the core, kind of as if you're doing that plank. Hold nice, tight, stable core. Hip back first. Really extend. You don't want that knee to be bent. That's another common mistake. Knees bent, so you want to be here.
and you're going to reach. Breathe. Hold it as long as you comfortably can, or you can do 10 to 15 seconds and do 3 to 5 sets. Tight in the core, leg back. Breathe. Very important to notice knees directly under the hips and palm, wrist under the shoulder. All right, this next exercise is one of my favorites. It's called a dead bug. You look like a dying cockroach. Most important thing with this one here, back needs to be flat. So let's go over what that looks like here. A lot of people that have in what's called an anterior pelvic tilt, they're going to have a lot of space in here that they need to get rid of. So what you're going to want to do is flatten the low back. As that low back flattens, the hips and pelvis almost come up. Think about bringing the tailbone up off the floor just a little bit as that low back flattens. So again, you do not want to be here. There's space in between my low back. You want to slowly come down and flatten that as much as you can. Nice and flatten in there. As you do that, you'll naturally feel your abdominal muscles engage. That's what you want. When you feel those abdominal muscles engage, you've got it. Then hold that posture. Bring one leg up. Bring the other leg up. And you can bring both arms up. The reason you want to bring both arms up, because the next phase of this, if this is easy for you, you can make it more challenging by keeping that low back very flat. Notice my tailbone is off the floor here. That's how flat I have my low back. To make it more challenging, you do opposite arm, opposite leg. Notice I was very slow, controlled, coordinated as I do this. For some people, just holding that's going to be too difficult. They may get the benefit just by flattening their low back. For some people that really haven't done any workout for a while, this alone might be enough. For some people, it might be this and then holding one leg at a time. But again, this is the dead bug. Key component to this is flat in that low back. Hold, and again, as I've said with all of these, breathe. All right, the next exercise is a bridge, or what they call a glute bridge. You're really trying to engage the glutes, get nice and stable in that pelvis. The key to this one, kind of like when we did that dead bug, you want to flatten the low back. As you do that, tailbone comes up, and watch my hips. They'll naturally start to just come up, and then you really want to come up from the hips and the pelvis. I'm going to show you the opposite, or the most common mistake. People come straight up and arch their low back. That is not good. You've got too much strain, too much pressure on the low back, and you're not going to engage the glutes enough. So the right way again, and the wrong way again. Now, option number 2. If that's easy for you, you can hold that for a while. You curl up, come up through the hips, and you can hold with one leg. Hold as long as you comfortably can. This makes it a lot more challenging and really engages the glute. I would say for most people, ideally, this is what you want to work up to. You want to work up to being able to hold this with one leg. For some people, they'll do that one leg and they just can't do it. They're shaky and they're unstable and they can't do it. So you're going to stick with 2 legs, but slowly over time, it might take you a week, it might take you 3 weeks, but you'll build up and be able to do that one leg. So again, let's do that again. I flatten the low back, come up through the pelvis, not arching the low back. And I'll do the other leg this time, and you hold. One leg. Some people like to do a march in place, and that's fine. There's a lot of alternatives, but the basic, I want you to understand the wrong way. The most important thing with this one is people really want to arch in their low back. It's not as effective. The goal with this one is to engage the glutes. So we come up and almost squeeze the glutes as you do this as well. And the final exercise, number 5, this is called a chair pose. This is going to work the quads, it's going to work the glutes, it's going to work the back, the low back, mid back. So you're working a lot of muscles in here. This one's great. The idea with this one is to sit your hips back first. First movement is back in the hips. This is called a hip hinge. If you're not used to this, you might feel heavy on your heels, almost like you're going to fall back. You just move slow, go as far as you can. You might end up here, you might get deeper. As you practice with this, your coordination will come and you'll get deeper. But you want to get deep in here and bring the arms up and reach and hold. Notice I'm not arching the back too much. I'm really trying to arch through my mid-back, or I'm trying to get the movement through my mid-back and through my shoulders more, reaching through the shoulders. Breathe. Relax. Let me show you that one more time. Hips back, that's the most important part. So I'm thinking about hips right here, going straight back. Once you've got that and you feel comfortable, you reach up and hold.